Hi, in this video, we're going to be talking about this equation of science plus systems plus physician relationship manager. We're just going to focus here for a minute on the first part of that equation, which is the science. It's very important that we learn the importance of the science and how to speak the language. In practice today, in the world of medicine and dentistry, every physician, healthcare professional has a referral network. And the question is, how do you get invited into the physician's referral network? What makes it happen that they would have enough confidence in you that they would immediately think of you when a problem presents with a patient, um, and that they would then make the referral in your direction? Well, we maintain that one of the first steps in developing this is that you have a very good handle of the science. We could also say it the reverse way, is that if you don't have a handle on the science, don't know how to communicate it and speak that language, it's not likely that you're going to find yourself invited into a physician's referral network. So it's real vital that we learn to speak that language. We believe that it's simply put that language is the science. Um, the emerging science becomes our authority, and especially when we're using their science, when this science comes out of their literature and we're taking it to them, that's very impressive to them, and it scores points and increases their confidence and trust in us. We're just going to really quickly run through some of the high points with the science as it relates to the oral systemic connection, TMD headache issues, and sleep apnea and dental sleep medicine. With regards to the oral systemic connection, um, the more we learn, that it's the same, and that is that we have a common thread that runs through many different disease entities, which appears now to simply be inflammation. At the risk of oversimplifying it, the point here is that when we have local inflammatory events that are acute in nature, which persist and become chronic, it changes from a local event to a systemic event, so that we have pro-inflammatory cytokines then running through the body and the general circulation. The one we generally think of the most and first is the one that we hear the most about, and that is a C-reactive protein. For a long time, it's been thought of as a marker protein. We now understand that it's also biologically active. But the CRP cascade begins with an inflammatory challenge, in our case such as periodontal disease, which produces in a local environment the inflammatory cytokines, which are meant to protect us at first, but when left to their own devices, will get into the general circulation, go to the liver, upregulate that, and produce C-reactive protein. The consequence of all this action is that we find local destruction in the periodontal disease, but we also find systemic diseases developing because of the pro-inflammatory cytokines. This list shows some of the diseases that are linked to periodontal disease. It's important that we understand that there's not causal connections between periodontal disease and this list, but there's still a connection. Again, it's the inflammatory connection that we're trying to make. Just hitting the highlight, we understand that cardiovascular disease is now an inflammatory condition. When we have atherosclerotic plaques building up in the intimal walls of heart vessels and elsewhere, it's due to the inflammatory nature of the cytokines that are in the bloodstream. Fortunately, we now have really good science and some good consensus that has been established between the medical and the dental arena. I'd advise you to get a hold of this and to print this out and read it. This is a very powerful one that actually sets forth clinical recommendations for both dentists as well as physicians and cardiologists with regard to the coexistence of periodontal disease and cardiovascular disease. When we move to the areas of pregnancy and pregnancy complications, low birth weight and early term, we also understand that the inflammatory cytokines in the body have an effect in the womb and on the uterus to produce an oxytocic effect that creates early term changes that cause premature birth. When you use the words PGE2 for prostaglandin E2, oxytocic effect of these inflammatory cytokines, and you use those terms and become familiar with them and discuss this with OBGYNs, again, they're going to be more inclined to realize that you know what you're talking about, and you understand these effects, and that they'll want to work with you. Another area is with regards to the area of diabetes management. The connection of diabetes and periodontal disease is among our stronger connections at this point. Even we have research now showing the highly increased mortality rate of diabetics who happen to have advanced gum disease. The point of all this is that in your own community, you want to insert yourself into and to become a member of the diabetic team, and that all these other healthcare professionals and diabetic learning centers and so forth in your community can become great resources for you, as well as you working with them. Skipping to now another topic, and that has to do with temporomandibular disorders and headaches. For those who are interested in treating these or have the skills to do that, we need to understand the medical side of this, the ear, nose, and throat aspects, unresolved ear complaints, as well as the migraine aspects of this and the effect of calcitonin gene-related peptide. This has to do with the trigeminal nerve, the trigeminal activation, or the activity, the efferent and afferent activity that's occurring on the trigeminal nerve, and the upregulation of the trigeminal nerve and to produce the CGRP, which then goes out the meningeal branch of the maxillary branch of the trigeminal nerve to the cerebral blood vessels, causing vasodilation and edema in those tissues. Those are all termed the peripheral effects of neurogenic inflammation due to the CGRP peptides, among others. The other side of this is what's happening centrally in terms of central sensitization in the brainstem in the trigeminal nucleus. It's very important to understand this, and if you do and you get this language down, it becomes much easier to go and talk to neurologists, chiropractors, physical therapists, and so forth. Again, the issue here is what's going on in the subdural area around the blood vessels when the trigeminal nerve meningeal branch of the maxillary branch is releasing these peptides into the area, producing vasodilation. Understanding that helps us understand the implications of posture of the mandible as it fits beneath the base of the skull, and all the proprioceptive and trigeminal activity, both efferent and afferent, as I said, as well as the coactivation that's going on with the upper cervical complex. All of this is related through the brainstem and the trigeminal nucleus and the integration in that area. And because of this science and understanding it, it opens up great possibilities for developing referral relationships with neurologists, ENTs, chiropractors, physical therapists, and anybody else that has a stake to play in this area. The next area has to do with dental sleep medicine. We won't spend much time on that, but to say that the new standards of care have been established with regards to the use of oral appliances in treating obstructive sleep apnea, working with sleep physicians, sleep labs, places that interact with people in their CPAP machines and fitting them and so forth. These all become real prime candidates to educate on the new research coming out on the effectiveness of oral appliances for mild and moderate sleep apnea. So the upshot of all this is how important it is to get your arms around the basic science and to prepare information to give to the physicians. I'd suggest that you put together some type of a science bibliography, or acquire one that MD-Referrals can prepare for you, already has prepared, that you can use as you give to the physicians to impress them and to educate yourself as well, all in an effort to become invited into these referral networks. In summary, when we look back at all this and say, what does the science allow us to do? Primarily, it allows us to communicate with the physicians. It allows us to exchange information with regards to laboratory tests, including the diabetic HbA1c measures, CRP values, DNA or interleukin-1 sensitivities, bacterial levels, MTHFR levels are now coming into vogue as we understand metabolic pathways. We can also share scientific articles. This is a great method for educating physicians and just periodically dripping information on them as you increase the strength of your relationships. It also allows you to take posture with patients, helping them understand that you are going to be working with their primary care providers and specialists. And the science also allows you to create PowerPoint presentations where you can go to their offices and train them and educate them on the connections between medicine and dentistry, which obviously all comes down to the bottom of where we can help improve the patient care experience. My advice is that you look at all of this and any opportunity to communicate with a physician as a reason or an excuse to interact with them. This is all marketing. It's about positioning, branding, and differentiation. And all of this matters very much when we're, again, trying to answer the question of how do you get invited into the physician's network.